What does skin removal look like after bariatric or weight loss surgery? In the abdomen, we call that a panniculectomy. And to get that covered by insurance, we have to evaluate a couple things. We have to make sure that you've failed medical management, so antifungals, antibiotics, and then also document that we failed conservative management and that there's problems with your ADLs, your activities of daily living, like dressing and bathing and just general functions that you need to do every single day. So when we look at what we are evaluating, you want to see that pubic bone and how far over that pubic bone by a matter of centimeters the skin fold hangs over that area, and whether or not there's multiple folds, like one that would fold particularly over the belly button as well. We would document all that. So when we're doing the surgery itself, what we're really going to be doing is a multiple incisions, because you can't solve a horizontal solution with a vertical problem with a horizontal solution, a horizontal problem with a vertical solution. So we're doing 2 incisions basically is what you're going to end up with the end of this. And so I will show you kind of where those incisions are. So here is the pubic bone, and then we're going to get a hip bone here, and then let's say a hip bone over here, and then your rib cage is going to be kind of up here, xiphoid, and then hip bone down here. So you're going to have this extra skin that's pulling down, and you may or may not have some back folds as well. And so what we need to do is make an incision that basically kind of runs along this lower area. And it's going to go out on either side of those hip bones, out almost to the side of the table if you would lay down onto a table. And that was a really poor representation of what we're dealing with there, because we're going to come under both those hip bones basically. And then we're going to look and see where we're able to pull that down. And I keep moving that the wrong way. And so and draw another line that basically kind of comes over the top like this. And in most instances, we're also going to make a cut around the belly button and leave that in, just cut around it and go straight down, so you have this post basically where the belly button is, and we'll sew that back into place at the end of it. And then, because we're pulling this down, we still got to manage this back rolls here that are, if we just pull this down, you still have those rolls and those folds, and you still have all this extra skin over in the front. So to manage those, what we're going to do is we're going to kind of see where this midline is and draw and make sure that we're in center here. And then we're going to make a cut that pulls all of this stuff in by removing all of this skin in that triangular, here I'll draw it in green, what we're actually removing. I like to call this the stingray procedure sometimes, because what we're removing kind of looks like a stingray. And so all of this shaded area in green is what's coming off. And so this right here is a new corner, and both of those corners move down this direction. So at the end of this procedure, what we're going to see is 2 incisions. One that's coming along the side here, and one that's coming up the middle like this, because here's that new edge that we saw before that was up here. Those are getting pulled down to here. So you have that additional tension, and then the belly button is sewed back into place. So that's essentially what we're doing with a skin removal surgery. When we have this exposed and removing all of the skin and the fat in between your muscle wall and and your skin, right? So all of that comes off all the way down to the muscle wall. And I can show you what that looks like down here in, let's see, let's zoom out and show you kind of what we're dealing with when we're looking at the muscle wall itself. So you can see these are the rectus muscles, and these are the side muscles. There's the external and internal obliques and the transverse abdominis, which are 3 different layers of your abdominal wall, and they all come to the middle. Well, in here you can see that in this perfect anatomical picture that the rectus has no space in between them. There's been no diastasis. And so what happens in people with a diastasis, or when you've had a large stretching and those abdomen muscles pull apart, now here in the middle, you essentially have this large section where there is no muscle and it's stretched out. So that when you bear down, you're going to notice this big bulge here in the middle. And what we'll do is we'll take sutures and we'll attach it to both sides, and then we'll go back and forth like this all the way up, so that when you get done, you essentially now have just this suture line, because we've pulled that tight and hopefully pulled those muscles back together. And that's what the diastasis repair, the muscle repair component of this panniculectomy is. I traditionally don't leave drains because, I think since last October, I've left 2 drains on everybody, 1 drain on everybody, tried to pick and choose based off parameters, if I leave 1 or 2, and then I've also left 0. And with the technique that I use, which is really just to cut down, when we saw, how we do this, you can either cut down on everything, where we just make these incisions like this, and we just go straight down to the muscle. Or you can make an incision right here and lift up and detach everything all the way up, and that's where you make these huge skin flaps. Well, then you have to reattach those flaps, and you create all this extra cavity for fluid to build up in. So I just cut straight down, and then we don't leave drains. And I think since last October, when I stopped leaving drains, we've put 3 drains in patients since then. And that's actually less drains that we put in over the previous year in patients that we were leaving drains in, which is way less than 1%. And we do about 5 to 10 of these a month. And so when you look at just the numbers of how many we've done, it's a very, very small percentage of drains that we have to put in afterwards without leaving drains. So then nobody gets drained. And then with a fluid collection or a wound, those definitely develop, and that's something that we talk about because this is a huge surgery and we're removing a lot of skin here. And so when we remove all of this extra skin from someone and we're pulling all of these pieces of skin in, it's important that all the blood vessels that are feeding these areas are still attached even to the ends of the skin, which is why I don't like to create a flap, because if I create a flap, I'd essentially be lifting this off and separating all the blood vessels that are feeding that skin. So I leave as much blood vessels intact so that when we get to the end of this procedure and we have this incision that runs right here and this incision that runs right here, I want to make sure that there's a lot of blood flow, because what we see is this separation of skin right here, and that's the most typical place for a wound, where they can develop out here to the side, where the skin doesn't want to heal because there's a decreased blood supply and an increased amount of tension, because we are folding people back together. I would say, don't hurt my taco stitches, We fold you back together to pull all this stuff back down. That's why we have everyone kind of walk a little hunched over for the first week. And so when we do this, we want to make sure we're doing everything that we can, wearing compression. And I always suggest wearing compression shorts that pull up over like shorts and they come all the way up over with the ribs. Even if they have a belt and suspenders, that can be pretty helpful, but you have to buy those aftermarket on something like Amazon or Walmart. And that way you're keeping that area compressed where you're not going to get fluid. And fluid leaking out of any part of this incision, and a lot of times, you know, that fluid can be leaking out here on the ends and sometimes through the middle. Just let us know, but it's typically a laundry problem, not a health problem, and you want that fluid to leave because then that fluid's not going to pool up and create something that we would need to put a drain into. So these are all things that we just have to manage. And because it's a big surgery and we're removing a lot of skin, typically between 4 and 10 pounds is going to be the majority of people. You got to remember that's a significant amount of skin. And when you think about how much that weighs, I'm trying to look and see. Oh man, whoa. One of our offices, look at this. Yeah, all right. Well, I'll just walk it down in front here. All cattywampus. It's trying to pick. Oh, here we go. There we go. It's trying to pick and choose where it wants to focus. All right, so you gotta remember that this right here, whoa, this giant, this giant piece of representation, this is 5 pounds. This is a lot of stuff. And think about this being spread out over a lot more skin. So depending on how thick your abdominal wall is, this is a lot of weight. And this is as big as someone's head. So that skin we're removing is a significant amount of tissue. So, oh man. Okay. So that's kind of what a panniculectomy is and what we do and kind of the post-operative expectations you can have. What we're trying to do is get rid of all of that extra skin, or as much of it as we can, and then get you as flat as possible so that we can, you know, increase your ability to bathe and dress, have that area not be inflamed so that in the summertime you're not getting a large amount of rashes and skin breakdown and bleeding and other problems. So that is a basics, 13-minute video about panniculectomies. I will get this up on TikTok and link this to Facebook and Instagram so you can see exactly what we are doing with skin removal, post-bariatric, and weight loss surgery. And I will try to get some more stuff together so you can see some actual examples and have a place to go where you can see what the skin looks like when we remove it and what it looks like in the middle of it. I'm in the process of doing a lot of different stuff to try and figure out how can we heal it better, how can we have better results, how can we move past this basic national average of a 25% risk of some sort of complication with it and keep that number in the 1 to 3% range. So if you have any questions, feel free to post them and we'll try and get some longer form stuff and maybe some patient testimonials out here on skin removal surgery after bariatric surgery. Not just the bellies, we can also talk about arms, butts, backs, boobs, and stuff. I don't do those, I just do the bellies. As a general surgeon, I try to stay more focused in the abdominal area. So, all right.